Well, what are the tools that we use? Well, there's a handful of tools that we use that are part of our everyday routine when we see patients. And then there's some really specialized tools that we use when it comes to looking at particular problems within people's eyes. So some of the most common tools that we use are a microscope called the slit lamp, and that allows us to look at all the small details on the front part of your eye. And then we use an instrument called a phoropter, and a phoropter is that device that looks like a big fancy pair of eyeglasses that the patient sees through, and that's how we figure out what prescription would allow the patient to see better, both at distance and near. And then there's a variety of handheld instruments that we use that helps us look inside your eye, into the back of your eye where the retina is, and make sure that all the tissue inside there looks healthy. And those are the most common tools that we use. And then there's some really specialized tools that involve lasers and instruments that help check the peripheral vision of patients. And there's instruments that house cameras that take pictures of the front and back of the eye. And even instruments that take digital images of the curvature on the front of your eye, called typographers, that help us determine what the nature of patients' cornea problems are. So one of the really nice things about optometry is that there's always new interesting tools to use throughout the day.